I used to work in hospitals as a trainee doctor in surgical max fac surgery. So I gained a lot of surgical skills through that, basic skills. Then when I started gallery in 2008, it was a very from scratch. Nothing was in Buckingham, small town, and I was a little bit worried that it was a small town to start my aim where I want to be. But it worked out well for me. But anyway, when I started, this place was no practice, nothing. This building was just empty, so we rebuilt the whole thing a little bit, and then we started gallery. The journey from the first year, we were doing maybe 5 implants a year, and mainly on just general dentistry. Then I had my aim to be an implant practice and then teaching as well, because I come from India where the education, where I come from, small tough village, the education was very very difficult to get. So, and thanks to my parents, so they worked hard to get me where I am now. So I have passion for the education and sharing my knowledge. So that journey took me from the gallery small practice to travel around the world to learn and different skills from different mentors. To name it, Professor Zuccali, Professor Istvan Orban, and Professor Corey. So those skills I learned, and then I started, and my gallery started to work on top of it every time, every year, and we where we are now quite well known practice. I had a good basic surgical skills from the hospital, and then when I came to general dentistry, I love general dentistry, and I used to do every bit of dentistry. But I started realizing that we can't be good in everything. So I want to pioneer or get better in one something which I love to do. Uh, so then I realized, okay, I tried orthodontics, I tried endodontics, different skills, but surgical skills I have the past experience, and then what I can do for the patients, change their life with a nice smile or a function and everything. So then skills and everything came together. So implant dentistry was my choice at that point. But mostly the referrals we get because we do the vertical bone augmentation or a soft tissue augmentation, which is complex cases. Patient who had implants who's failed, or a patient can't have implants, particularly posterior mandible. They have an inferior nerve very close to the not able to place any implants. Then these are the very complex cases we get from my colleagues from all over the country. If anything complex cases, I do start to finish. For particularly vertical augmentation, it's not only bone augmentation. When we got to soft tissue augmentation, then the restorative work need to be perfect for that work. Otherwise, the long-term prognosis can be affected. So complex cases, I do it myself. But some of the cases, simple cases, yes, I do a surgical side and then they go back to restorative side for the dentist. More and more, I'm doing more complex cases than regular implant placement. Purely because the implant placement can be now lots of clinicians are doing implant, which is fantastic. I'm very happy about it because patients have access for easy access for implant placement. So that's maybe 30% of my work is regular implant placement. 70% are complex cases, bone augmentation, soft tissue augmentation, or rehabilitation, full mouth cases. When I started the practice, maybe I was new as well in this area. I used to do 5, 10 a year. Now we do 300 to 400 implants a year. Again, some clinicians feel that 300 400 is not lot number. Yeah, again, I understand that with the complex work we do with all the different techniques and different bone grafting things. And 300 number of implants isn't just not a thing. What we do it right, do it well. So you think about 10 years of success or more than 10 years. Yeah. The main thing as a clinician, I'm old school oral surgery trained. So I've been trained in such a way that I can use handpieces and burr to, for example, doing sinus graft lateral approach. I've been trained, I've been doing this for years. But the more and more I want to get 100% predictability for myself and for my patients, I want the instrument equipment which is going to work in such a way. Hence, I started various search. I was like, not sure about it because I can do without that. But once I start using it, learning it from now, I wouldn't go back where I started because It's much more friendly for the patient and easy use, easy for me. And then the success rate and then ease of use with a particularly thin membrane and everything. It's amazing. So as a clinician, I look for a few things. One is the one which is going to work for me, not going to fail in halfway through the surgery or whatever. Second thing is it need to be good for the patient and it need to be benefiting the patient. And third thing is the company support. And the various surgeon, the NSK equipment, we have fantastic equipment. I had for years, and if I service it regularly, I it works. It doesn't stop anything at all. That's one thing. Second thing for the patient, because when you doing a big surgical procedure, it need to be comfortable for the patient. For example, noise of the instrument, or when you're setting some uh, things, then you need to work in such a way that it does not going to be not working on the day of the surgery. And then the third thing is the company support is very important for us. If, for example, if I send our own equipment to the NSK saying it needs servicing, but I got patient booked next day, they always give me a spare one for me so that my practice are not stopped because my equipment is in the service. So the company who work with is amazing support, great equipment to work with, and then it helps me and my patient. The equipment works very well with the various surgeon and the surgery pro. It works together. It's fantastic. You don't have to have so many equipment here and there. When connected to each other, they're next to each other. The handpiece are beautifully aligned for me to work. So when I need it, it's next to me. Both the things working on the top of each other, and that helps me. It cuts my surgical time as well, rather than trying to find things where they are. It reduces my surgical time for me and my patients. Mainly, it's reducing the surgical time for them so they don't have to stay in the dental chair. Even though you have whatever the chair you buy, lying in the same position for a long time is not easy. And it reduces the swelling, post-operative complications are reduced because you're reducing the time of the surgery itself. When you have a good equipment and a good team and good support from the companies, it's a teamwork. The tip I use is the sinus lift tip, and because you're not going to perforate the lining by using this. So again, one of my favorite surgical procedure is sinus. The sinus is different for every individual patient. Flow, shape of the sinus, anatomy of the sinus, thickening of the lining is different, bone thickness is different. So using this tip, it helps me to evaluate all these things before I go in there. And once I done it, lifting a membrane with the a tip as well is easy. Sometimes you get a septum in the middle, which is very hard to use. With this tips, and I love it. It's quite makes my life easy. When implants, particularly full large cases, it's so easy purely because so many ways it helps because you don't have to worry about screwdriver when you put it in trying to minimal access area posterior mandibular posterior maxilla. You could try to go back and there with the screws with the fingers and it lose it's patient danger of swallowing or inhalation. And second thing, access is so difficult. For our back as well, you got to twist your wrist to do quite a lot. With this one, there's no uh, opportunity to lose your screws because securely it's attached to the latch grip. So then it's a single piece. It became a single piece with a contour with the button, which is piece of cake. So you just put it where you need to be, and you just torque according to what torque is set up. Setting a torque is very easy. You got up and down button to set it, and I use it even for removing cover screws sometime or healing abutments. The posterior maxilla, if you can't do it, I just put the hex screw in and anti-clockwise. It removes healing abutment beautifully. And I use it for single crown attachment, again, posteriorly, anteriorly, anywhere. It's very easy, and then you are sure about the torque as well. You don't have to, sometimes with the manual, you can miss the torque. And you can over torque it or you can under torque it, depends on how you do it. But with this, it's just all checked for you and it's done. Sometimes we think, oh, why do you need that? We can do it with this. But until you have it, you don't realize. Very simple thing I tell all my colleagues and friends is that sat nav. We did travel everywhere without sat nav. Right now, we don't buy a car without sat nav. I mean, it's simple as that. Still, you don't need a sat nav, but it makes your life easier. Yeah. So without satellite navigation, yes, we had a map and stuff. We've been everywhere. Nobody stopped traveling, but it took extra time. But now, just with satellite navigation, you don't have that. But same thing with this equipment. When you have good equipment, good things, saves your time, saves. You can put that energy of doing all those things into the treatment itself. That way, you benefit, patient benefits. To buy equipment from NSK, the support from them, and then when I pick up a phone, straight away there's somebody there on the other end to help me, or even come to the practice to look at the problem or issues, or shipping another equipment straight away for next day surgery. Everything is very important. Yeah, the quality of the equipment is important, but after sales support, it's definitely important, and which I get from NSK. So the ASHA Academy, the Academy of Soft and Hard Tissue Augmentation, we started 6 to 7 years ago as a aim of bringing skills from different part of the world and then share the knowledge with a UK dentist and then bringing the UK dentistry to a next implant dentistry to a level we need to reach. And that's why I started the academy. And now we are in the 7th year, and then we run 2 hard tissue courses a year. Each course is 4 days. So 2 days part one, 2 days part two. The part one we talk about simple horizontal bone augmentation, that sort of thing, and part two we talk about the complex vertical augmentation. And then we have another course just purely soft tissue. And the same thing, 4 days, 2 days of minor soft tissue and 2 days of major soft tissue augmentation. So it's take the skill level to any implant dentist who want to do the work properly and achieve the aesthetic results and the long-term success. These courses are very, very important. We take limited space of 20 delegates per course because we don't want to have anything more than 20 because we want to concentrate on the delegates who want to learn, and we can give individual support and then mentor them following the course as well. They have been very great support in that. And I can see that they believe in education as well because that's why they have the training center in NSK building in Stevenage, which people like us and different of my colleagues and courses there as well. That's very, very impressive. Anything the NSK like various surgical side and other things, yeah, they are very hand pieces. Yeah, they are very helpful. The journey has been a long journey for me because I came from India to here, and then I try to get where I want to be, and still, and my aim next is to just do, even if I change the implant dentistry in UK, even at 1%, I'll be happy. And because my aim is to everyone should be approachable in the implant dentistry. Everyone should help each other and sharing knowledge. So we can grow as implant dentists in this country so much together. There are enough patients for everyone. There are enough clinicians and enough patients for every single clinician. So my aim is to bring the implant dentistry, standard of implant dentistry, raise the bar to next level, so that we can be proud of ourselves as a country that what we are equally good as every other country in the world. I'm very particular about the companies I work with and then the equipment I use. And so NSK is one of the sponsor and company who I work with very happily because the support is great. More than that, the standard of the equipment is so high, and it's fantastic equipment. So I don't compromise on anything when it comes to work and stuff. So if I'm working with NSK, the NSK is working with me as well. That's got both ways. So we need to work. So it's a fantastic equipment. And then there's some same again. It's not only the clinician, the companies in UK as well, like NSK and JNS Davis and other few companies are doing the same thing. They are investing time and money and to educating dentists or helping dentists to learn more, and that's what changing.